there, I'm Dr. Jenna Corey with the Brush Stop Pediatric Dentistry. I'm here with Alyssa today. We did a revision for Alyssa's son, Bentley, 3 weeks ago for an upper lip tie and a tongue tie. And I just wanted to talk to Alyssa a little bit about how her journey was throughout the whole process and how the healing's been going.
Initially, I'll be completely honest, I was very, very nervous to have anyone in the mouth of my 2-month-old.
Of course.
Just when he was diagnosed by a lactation consultant with the lip tie and the tongue tie, it was almost a relief actually, because I was having so much pain nursing and he also wasn't gaining weight as much as he should be. So it was helpful knowing that there was possibly a cause, and then coming in to you and having just that initial consultation and you explaining kind of, okay, this is how the lip and the tongue tie even began when they're in utero. That was just getting some of that background was very, very helpful. And then at that same consultation, having you explain to me, being very realistic about, you know, there is going to be some follow-up. You're going to have to do the stretches for the recovery. That's just as important, more important than like the procedure itself.
Absolutely, and we feel like those stretches are incredibly important to getting the result that we want. And you know, the reality is it's not always perfect. It's not always sunshine and flowers. Sometimes there are some rough patches after the procedure. Maybe you could touch on that a little bit, how you felt the healing was, and with the stretches the first few days.
Right. The first few days were hard, definitely. He had a little bit of inflammation and I could tell that he was uncomfortable. I don't think he was in a ton of pain because it's not like he was crying non-stop, but he definitely didn't like us in his mouth. I would say the first day, maybe the first 48 hours. He really didn't want us in there touching.
Right.
But after that, honestly, you taught us how to be fun and playful with the exercises and sing to him and just try to make it like a fun time, and he did great. I mean, after 1 week of doing those stretches, I could tell that he was in no pain at all. Right. He still, like in the middle of the night, he doesn't like us in his mouth, I think, because we're disturbing his sleep.
Of course.
But during the day, he's completely fine. He doesn't fuss anymore. He lets us get in there, and I mean, it takes maybe 15 to 20 seconds really to get in there and do the stretches, and then he's back to playing and smiling and cooing.
Absolutely.
And so they really weren't that bad. I was very, very nervous about that commitment, and I knew that's why we had that initial consultation.
Yes, we usually want to give you a couple of days to practice the stretches first. Part of that is for you to see that the baby will likely cry even though there's no cuts or anything like that. There's no surgical procedure done yet. They're still crying even though you're in there. They're just irritated.
Yeah.
They just don't want you in their mouth, and that's normal.
Right, and so it was really helpful being able to practice those exercises for the 3 days, or actually it was almost like a week or so, and to get my husband practicing them too, so that it wasn't just me doing those stretches. But that was incredibly beneficial. I'm very, very glad that we were prepared going into the procedure and knew just what to do when we walked out the door.
Wonderful. And now that we're a few weeks in, maybe you could share with us how your experience has been after the revision.
Well, I'm happy to say that my son has gained 2 pounds in almost 4 weeks, so that is fantastic. I mean, that is exactly what I wanted to hear from his pediatrician. So, you know, I think so much of it was due to the revision, and I'm so happy to recommend anyone who's having any questions or just like if they're nervous to do it, it's completely worth it. I mean, do your research, definitely. I just gained a lot of trust from you during that first visit, during that first consultation, and just you being very real with me and telling me how it's going to be, what could happen if we don't get the procedure done, what some of those side effects might be down the line. And I'm so happy that we did it now when he was only 2 months versus waiting until he's a little bit older.
Absolutely. Yeah. Great. Well, thank you so much, Alyssa, from the bottom of my heart for sharing. It was so wonderful. We're so proud of Bentley and all of the progress he's made.
Thank you.
So thank you again.
I appreciate it.